Medurstand. Understanding medicine.
Professor Azizur Rahman again from Medurstand. We are doing the clinical methods. We have already done examination of pulse, and now I'm going to demonstrate the right method of the blood pressure measurement. Blood pressure measurement can be done with any of the three types of blood pressure apparatuses. It may be this conventional mercury based, or it could be aneroid, or it could be digital. Whatever blood pressure apparatus is used, it needs to be calibrated and in good condition. And patient should be sitting like this, and I think best is both legs hanging and resting on the floor. And patient should be sitting comfortably, ideally with a backrest, but since there is no backrest here, so I think this is also okay. Patient should be relaxed. Patient should not have eaten or taken food immediately before measurement. Patient should be resting for at least 5 minutes, because even if you do little movement, you get up and put the light off or on, your heart rate goes up, your blood pressure goes up. So when you are measuring blood pressure, patient must be seated for at least 5 minutes, and he's been seated for more than 5 minutes, so I can go ahead with measurement of blood pressure. So there are two methods. One is palpatory, the other is auscultatory. First, let me demonstrate the palpatory method. For both you need this apparatus. So this is the cuff. It needs to be deflated. You do it like this. You press it. You of course open it from here and deflate. It should have no air before you apply. And this column should be at 0. So if in this type of blood pressure apparatus, if the mercury column is at 0, and when you inflate, the column doesn't break, that means this instrument is calibrated. So we apply it like this. So this is here. We apply this. We actually apply on the brachial artery, approximately 1 inch above this cubital fossa, like this. And it should be applied firmly like this. There should be no air between cuff and the arm. So like this. I will put my thumb on the brachial artery, and you know the normal anatomy, the brachial artery is only slightly medial to the midline. So I think it is somewhere here. Yes, my thumb is exactly on the brachial artery. So I can feel the pulse because there is no pressure here. I will inflate the cuff like this and will keep feeling the brachial artery, brachial pulse. So once pressure in the cuff exceeds the pressure in the brachial artery will collapse and the pulse will disappear. So that way we will estimate the systolic pressure. We will not be able to determine palpatory pressure, the diastolic pressure with palpatory method. But it is important to do this method before you proceed with the auscultatory method. So I am gradually inflating it. See, this is inflating. I can still feel the pulse, and I am looking at the BP apparatus. It is at 110, I can still feel it. 115, I can still feel it. I think at 120 it has disappeared. But I will go further up, maybe 10, 20 degree, and then deflate it again. I will see at what level pulse reappears. I am gradually deflating it. Yes, it reappeared at 120. Then I have to deflate all the way to 0. So when I was inflating, this brachial pulse disappeared at 120, and then I went up to 140, then deflated, pulse reappeared at 120. That means his systolic pressure is 120. Since this is palpation, this may not be absolutely perfect. There may be just few millimeter mercury difference in the auscultatory or with the digital one, but this is how we determine systolic blood pressure. With this technique, we cannot determine diastolic pressure, but still it is important, because with auscultatory method, sometimes you can wrongly judge the systolic pressure because of auscultatory gap. So what is that phenomenon? I'll explain when I demonstrate the auscultatory method. So this was the determinant of systolic blood pressure with the palpatory method. Now in some situations, when suppose patient is very sick and you're standing on the bedside, just the systolic blood pressure may be good enough, right? But mostly we determine both systolic as well as diastolic, and that we do with the help of a stethoscope and using auscultatory method, and that I'm going to just demonstrate. Thank you.